Добрий день. Мене звати Raya Dzulyńska. My name is Raissa Dzulynsky. Today, I'll be interviewing Dr. Ulana Kawun, our 9th alumni of the Alumni video series. Dr. Kawun is a general surgeon based at the Scarborough Health Network. She was also a surgeon for Canada-Ukraine Foundation's Operation Rainbow medical mission that performed reconstructive surgeries for soldiers that were fighting for the front in Eastern Ukraine in 2014. Thank you for coming. Thank you for agreeing to do this. So my first question is, where did you go to university and what did you study?
Well, firstly, thank you so much for inviting me to participate. I mean, this is a truly great initiative. It's been wonderful to watch. I started off my university at McGill. I did an honors bachelor's of science in human anatomy and physiology. Then I went on to McMaster University and completed my Doctor of Medicine. After that, I was accepted into a 5-year general surgery residency program at University of Toronto, after which I became a fellow of the Royal College of Physicians and Surgeons of Canada. And finally, I ended up in Pennsylvania, where I did a 1-year fellowship in minimally invasive colorectal surgery at the Lankenau Hospital.
That is very and you're very accomplished. My next question is, what was your involvement in SUSK or your Ukrainian Student Club at your local university?
So most of my time in university was spent at the McGill Ukrainian Students Association. I was VP Finance from 1993 to 95, and then I spent a year on SUSK as VP Internal. I grew up in Toronto, so I was quite accustomed to the big University of Toronto pubs and social events and political events. So when I came to Montreal, the community was a little bit smaller, but no less dedicated. The McGill Club had been a little bit quiet before we had arrived. And so we had a new team of students from all over Canada, and we rejuvenated the club. We were quite fortunate. We had a lot of support from the Ukrainian community, from the Sumyutsy, the Plastune. We teamed up with the Concordia Ukrainian Students Association. And ultimately, also, we joined up with the Montreal Professional Businessmen Association. So yeah, it was a lot of fun. We had a very strong group. I guess I was most proud of our work on campus. It was the early 90s, and Ukraine had just become independent. So everyone really knew Ukraine as part of Russia. So there was a lot of education that went on campus. And, we started off participating in the McGill Culture Days, but ultimately we ended up having our own Ukrainian week on campus. So we had banduriste, tansuriste, we had, people painting pisanki, and of course, perehe. We had guest speakers such as Yuri Luhovi, who spoke about his movie, Freedom Had a Price. We were quite proud of what we had accomplished. Another great thing we accomplished was by the end of our term, we had become board members on the Montreal P's and B's executive. So this truly kind of helped foster mentorship and networking within the community. And also I had the opportunity of being a Congress coordinator for the 1994 SUSK Eastern Conference. So that was fun. It was a lot of hard work, and we did it in conjunction with the famous Montreal Tribita Zabava. So yeah, it was a fantastic time all around.
That sounds impressive, but also very fun. I know we're all looking forward to having a Congress in person, but for now we'll be having a Congress online, which we are also excited about.
Yeah.
But I'll make sure also that the McGill Students Club that still exists, still going strong, but make sure they see this interview.
Oh, fantastic. Good to hear.
Yeah, we have on the SUSK executive right now, we've got 2 people from the McGill Students Club.
Oh, great.
Students Club. So.
Oh, fantastic.
And so the next question is, and you've mentioned this a little bit, but what is your current occupation?
So I'm a practicing general surgeon. Shortly after graduation, about 15 years ago, I did a few locums. A locum is kind of like a temporary position where you sort of feel out where you'd want to work, what kind of population you'd like to work with. I worked in Orangeville for a couple of months. And then I actually did a locum up in the Indigenous community up in Moose Factory. So I was the only surgeon in the area for a short time. But funny thing, I bumped into Dr. Adrian Levitsky, who's family medicine, and he was kind of running the hospital over there. So it's a very small world. Ultimately, I accepted the position at Scarborough Health Network, and I've been there for the last 15 years. Primarily, my practice is largely oncology or cancer surgery. I was trained in laparoscopic, or sometimes known as keyhole surgery, to treat colorectal cancers. Of course, over the last 15 years, there have been many, many changes to technology and the information. So I've been able to bring in some of these new technologies into our hospital, one of which is called TAMIS, or transanal minimally invasive surgery, which gives patients different options in terms of surgical management of their tumors. And of course, there's a very high prevalence of breast cancer in the community. So half of my practice is breast cancers. Over the last 15 years, I've gained certification in something called oncoplastic surgery, which is the application of plastic surgery techniques into our cancer cases, so the patient has a more favorable outcome long-term. So apart from my active practice, you had already mentioned that I participated in the Canada-Ukraine Foundation Medical Mission. And I have to say, it's almost like a sweet spot in your career when you're able to kind of apply your life's work to something, so important personally, such as my Ukrainian heritage. So of course, this was envisioned by Dr. Oleg Antonishin. And as you said, we worked on the disabled and disfigured soldiers who were fighting at the front. In November of 2014, that was the inaugural mission. And I was in the operating room working with the plastic surgeons on these reconstructive cases. I returned in May 2015. I was asked to implement something called ATLS, the Advanced Trauma Life Support Program. This is a well-known program used throughout the world. These are practices and methods that are applied at the front when people are critically injured, to help increase their chance of survival by the time they get to the hospital. So I had brought that program to Ukraine. One of my colleagues from Scarborough Health Network, Dr. Naresh Mohan, who's originally from Trinidad, he came with me and we presented the programma for the first time. And this was all done in conjunction with Dr. Ulana Kawun. So very interesting, very fascinating times.
Definitely. Congrats. I think that's very impressive. And I know everyone in Toronto, or I know a lot of people were watching and learning of the news and waiting to hear back about the mission. So again, congrats.
Thank you.
Question, I'm curious, but you mentioned a lot, there's a high, I guess, prevalence of breast cancer. Is that in the area in which, your patient population comes from, or is it our like population structure in Ontario? I'm just curious.
In Canada, it's been shown, if you look at the Cancer Care Ontario statistics or Canadian statistics, anywhere between 1 in 9, 1 in 10 women will be diagnosed with breast cancer. That's all stages of breast cancer. So anywhere from stage 1 to stage 4. So, now with the screening technology such as mammogram, so forth, we are finding these tumors very early on. So the survival rate and the recovery rates are great, if we can get to these cancers sooner. And the same goes with colon cancers.
Mm-hmm. And in terms of oncoplastic, that would be like breast reconstruction surgery. I watched a surgery once.
So, surgery, in a lot of the breast cancers, surgery is the first step. And it definitely depends, are you removing, a 1 centimeter tumor versus are you removing a 5 centimeter tumor? The smaller the lesion, the more you can leave, the contour of the breast, the shape of the breast, but the larger the tumor you need to remove, the more distorted the breast can become. Or sometimes a woman needs a total mastectomy. So with oncoplastic techniques, we can help reshape the breast so it can look, the woman looks more equal, so she doesn't have those scars or those reminders of all of the trauma she's gone through. So, before we didn't have these techniques, so women would have quite a bit of scarring and disfigurement, but now we can offer them a much more cosmetic outcome.
Yeah, I think that's cool. Hopefully, I'm not the only one that watches that thinks it's cool. So my next question is, and I'm sure you've heard this question and topic many times, but how's your experience with COVID been? What are your thoughts on the current vaccination efforts?
COVID, I mean, first, foremost, I want to give out a shout out to my colleagues out in the Scarborough Centenary or Health Network, and to everybody who's kind of been fighting on the front lines. It's been many, many months since we've been doing this. And we've been doing this in the midst of treating the usual, the regular illnesses, right? Heart attacks, cancers, that still goes on. Everything you hear in the news is true, if not even a little bit delayed by the time it goes out in the news. This week we've shut down our pediatric ward. All the pediatric cases have gone to sick kids because we need room for our adult COVID patients. This morning, within 45 minutes of me starting my work, there were 3 protected code blues you could hear over the PA. That means 3 COVID patients had to be intubated and transferred to the ICU. So everything you're hearing in the news is correct. It's real. At first it was quite terrifying. A year ago we were all entering this we didn't know half the information we know now in terms of how it affects our children, our parents. So it was pretty terrifying. It's sad to say we're kind of more used to things now. I go in every day, I have to wear full PPE. I see my colleagues every day, but I haven't seen their face in over a year. So, there's some sad realities to it all. Vaccines, no doubt, are the way out of this. Okay, if people don't get vaccinated, there will be tremendous illness. There will be tremendous, death rates as well. So there's no question that the vaccine is the way out. There's a lot of questions about the vaccine, and a lot of questions, but you really have to put things into perspective. I think the companies are trying to be very transparent. That's why, out of 2 million AstraZeneca shots in UK, you get 6 clots, which is even less than the the incidence in the regular population. So these are very safe vaccines. I guess lastly, everybody's getting frayed at the end of, everybody's nerves are getting frayed at the end of the year. I strongly recommend, just be compassionate. Fighting COVID is not just a personal thing, right? You have to take care of yourself and your family, but you also have to take care of your community, because what part of our community is going to come out after all this, right? We're all dealing with this very personally, so we need to be respectful, kind, non-judgmental. And if you're able to stay home, please do so. First you're protecting yourself, you're protecting your family, but you're protecting all those essential workers that have to go to work, right? So if we can give them space to do their work, then they'll be healthier and stronger. I mean, it's frustrating because, recently I came across this Facebook post, how, this woman was fighting for her rights, and she was so proud that she refused the COVID test before surgery. And she was, telling other people how to do that, because of her rights. And it's sad because it's actually in her best interest, because we know that even asymptomatic COVID positive patients, have up to a 40-50% chance of complications after surgery, primarily respiratory. So we're doing this primarily to protect the patient. And secondly, don't you want to protect the healthcare providers who are helping you, who can then help someone else? So I know everybody, it's frustrating, but we need to be patient and we need to be compassionate, right? We need to take care of each other. So those are kind of the thoughts that go through my head when dealing with this over the last year or so.
Well, thank you for sharing. It's I'm honestly very good for everyone to hear. Um, I don't mean to abruptly change the topic, but moving on to a typical question that was a special edition, because I'm sure everyone wants to hear what the doctors want to say these days.
Mm.
My next question is, how do you think SUSK, or your USO, or your Ukrainian Student Organization, helped you in advancing your career and or personal development?
So practically speaking, I'm sure a lot of us grew up in Zoom or class, and we were able to, take initiative roles and be leaders. But here, I felt that working in McGill Ukrainian Students Club, you could actually put these skills into real world practice, right? You had to interact with the community around you. You had to be able to engage, interact, approach people. These were businessmen, these were professionals, scholars. So, that takes practice, and everybody was more than welcome to help. And then, especially with these congresses and these more formal programs, that's a lot of organization. That's a lot of communication. I mean, I remember back in the 90s, I was just when internet was kind of opening up, and I had to kind of run to the McGill library to kind of, for my half-hour spot to be able to send out all these emails across Canada. So, being able to be an effective communicator is definitely something important to have learned. So, yeah, I think the Students Club really gives you a chance to practice these skills in the live world, in the real world setting. Also, what I found interesting is, again, this might be more of a personal experience, but growing up in Toronto, it's very easy to kind of have a Ukrainian-centric upbringing, which, is very positive and definitely benefited me. But it was great to be out in university and with all these other ethnic or cultural groups. You really, it was fun, number one, to learn about them. It was fun to eat the food. You got to learn about their struggles, their challenges, which were not all that different from ours, right? From the struggles that Ukraine might have had. So throughout all my experiences, I think this openness to other cultures really, benefited me more than anything else. When I was in Philadelphia, I didn't know anyone, so the nurse would take me to her primarily African American Baptist church, and we'd sing there for 4 hours, and then my mentors would take me home to celebrate Hanukkah with them. So it's these interactions and networking outside of our community which are very beneficial. Even my patient population now is more Southeast Asian. We celebrate Diwali with them, and it's fascinating, it's fun, and it definitely shows you how we all need to be part of this world stage, right? So, and personally, also, I went to university when I was quite young. So McGill, the Students Club, was almost like a second home. And it's quite nice to have that community that supports you, and it gives you a lot of confidence to go ahead and pursue kind of your dreams, for example, medical school. And you never feel you're missing out, and you always feel you can come home when you need to.
And there's a lot there to comment on. I guess one thing you talked about, taking your skills and using them in the real world. And I think for me, SUSK and being part of my student club at Western University really gave me that opportunity in that, so I was in PLOS growing up and learned a lot of skills. So were you in PLOS or SUM or?
I grew up in SUM.
Okay, very nice. So just a lot of these skills that you learn in PLOS or SUM while you're young, but you're in a very sheltered environment. Mm-hmm. And then you take them and you almost transform or change those skills so they can be applied to a broader set of whether initiatives or people. And I think that SUSK definitely helped me with that.
Mm-hmm. Exactly.
And I guess the other comment I had on that, something I've been thinking about lately is, I guess with COVID and just the idea that we want to have our own identities. We want to be, a culture that we identify with, or a group that we want to identify with. But then we need to also make sure that we don't, in creating these cultural identities, we don't create a us versus them mentality.
Right.
And I think that's very important. That's just something I've been thinking about lately. When just things that are happening in the world, like blaming other groups, and I think kind of you mentioned that you it helped you understand that we all have many groups have similar experiences, and actually benefits us to work together rather than have an us versus them mentality.
Absolutely. We're all in this together. So
For sure. And then I guess the last question on that, side question. You mentioned that your Ukrainian-centric upbringing benefited you. I was just curious whether you could provide an example. It doesn't have to be student club related.
well, I think that and I want this for my own children too. I think when you're in a strong, when you're raised in a strong group, um, and even us, I was SOM and half my friends were PLAS. We can go through either group together. It didn't really matter. There was a safety net, right? Everybody's parents would take care of you. And that gave us the opportunity to be independent, right? We could, because we all knew where we're at so-and-so's house, or we're going up to this camp or this Zabava. We're all together. We're all being responsible, sort of, most of the time. But, in that way, you develop independence, and when you travel to SUSK in New York to go to Tabid, you meet new people, and I'm still Facebook friends with these people from Tabid from 25 years ago. So, I mean, that's fascinating, right? And so I think it just gives you, it's important. I think it's very important to have a strong community, because there's lots of people to learn from, lots of people to support you, lots of people to take care of you as you're growing up. And and it's a home you can always come back to. Obviously your own parents are kind of the focus of all this, but when you have a big community to come back to, be it Veselka, the SUM camp with my children, I mean, it kind of, the cycle repeats itself, right? And hopefully we can provide that strong, healthy, safe environment for our children.
I agree. I think I've had a similar experience, although a few years later. My last question is, do you have any tips for current students that can be related to SUSK or Ukrainian Community, Ukrainian Student Club, or just general career tips?
Sure. Specifically for medicine, but I'm sure it goes for any profession. I guess when you're applying or striving for a position, job, or application, you have to figure out, how do you differentiate yourself? How are you unique? How are you special? How are you going to be different from all those other people with the same high marks and the same kind of volunteer experience? So I strongly urge people to find that unique quality or project. So how do you come by these projects or ideas? Well, I believe you need to kind of phone people, email people, approach the mentors or people in your community, ask them lots of questions, have lots of discussions, brainstorm, and then you can come up with a project that is uniquely yours that will make you stand out. And this is something that, and this ultimately would go in your CV, your applications. And then these people who've helped you develop this program or project would likely be the people who would be writing these referral letters for whatever applications, jobs, and so forth. So that's probably my first real recommendation. Secondly, don't be afraid to get out of your comfort zone. Sometimes when I speak to the young kids at Tabir, they want to be this and this, but they're too afraid. They're afraid, oh, they won't get in, or it's too hard, or they'll fail. And I'm like, it doesn't matter, right? If you don't try, how do you know you won't get it, right? What did Wayne Gretzky say? You'll miss 100% of the shots you don't take. So you need to step out of that, be a comfortable community, comfortable routine, and just strive for whatever it is you want. There are lots of opportunities out there, but they won't be handed to you. You have to knock on doors, you have to pick up phone, and the majority of the time, people will be more than happy to help and more than happy to kind of help you figure things out. Um, and there's a lot of, yeah, it is hard work, but there's a lot of fun that comes with it. I mean, when I was in medical school, I ended up living in Brazil for 2 months doing trauma surgery. And the funny thing is, my bus stop where I had to go to work, the bus stop was called Tarashevchenko. Of all, I mean, how is that even possible? But and then also I worked in Ukraina as a medical student doing surgery. So the opportunities are unimaginable. You just have to kind of do the legwork.
For sure.
Lastly, just never forgive to give back. Never forget where you came from, right? Your parents, your family. These were the people. I mean, in your community. This is why ultimately you've succeeded. So you should always, be respectful. Always come back and try to give back in any way you can.
Oh, thank you. I think just in terms of like reaching out to community, doing that legwork and hopefully getting your foot in the door somehow, making some connection. A program that SUSK has been in the works for a while, but finally launched this year is SUSK Connect. It's a
Mhm.
I don't know if you've heard of it, but it's
I have, yeah.
oh, you have. Okay, so it's I guess for our viewers, it's a very casual networking or mentorship or networking program where students can reach out to Ukrainian professionals. Because I know as a fifth year student now, as a graduating student, it definitely helps to have and to use your connections, and
Yeah.
whether that's to get your foot in the door for some sort of internship or just to learn more, try to figure out what you want to do. I think that's always a struggle. It's always been a struggle for me, and I'm sure I'm not the only one that has had that struggle as well.
Yeah.
Anyways, дуже дякую.
Oh, there's a proszę. It was a great talk.
I was gonna say it was great to hear from you, and I'm sure others will enjoy hearing from you as well.
Yeah.
Slava Ukraini.
Heroям slava, and stay safe.
Thank you too.